Hello, everybody. This is the second and final part of the protocol of reversal of how to reverse Alzheimer's disease. This is an extension of the previous video. We reached to the point when we explained that Alzheimer's disease is not only one type. When we said like fever, nobody go to the doctor and say when he has fever and the doctor say to him you have fever. However, the doctor say to him you have fever due to something, due to tonsillitis, due to infection of the kidney, whatever, but he has to specify the cause of the fever. Same applies to Alzheimer's disease. We need to know Alzheimer's disease due to what. And Dr. Bredesen has classified Alzheimer's disease into 5 types. The first type is inflammatory, the second type is atrophic, when there is no enough nutrients, and type 1.5 the insulin resistance, type 3 due to toxins, type 4 vascular, and type 5 traumatic. So when we have patient with Alzheimer's disease, we need to know which type this patient is, and sometimes the patient fell into a category of 2 types in the same time. Now I'm going to go through each type of them and explaining how to identify this type and how we treat. The first type is the inflammatory type. The causes are chronic bacterial, viral, or fungal infections. The most important bacterial infection that live long in the body and can reach to the brain is the infection of the root canal in the teeth and the periodontitis, the periodontal disease and the root canal disease. The bacteria is called B. gingivalis and T. denticola and F. nucleatum. This is for doctors to know. However, you need as a person to know that the teeth health is very vital if you are prone to have Alzheimer's disease. Like if you have father or mother or grandfather or grandmother, you are prone to have Alzheimer's disease, you need to take care of the root canal and the periodontal disease. Also sinusitis, chronic sinusitis, especially there is one microbe called Marcons. For doctors it is called antibiotic resistant coagulase negative staphylococci. This organism has been found to reach to the brain through the chronic sinus infection. Herpes simplex number 1 that affects the lips, and the HHV60 that go also through the sinuses. So you need to take care of your sinuses and your teeth. These are the microbes that has been found in the brain of Alzheimer's disease. Also, some of these microbes are found in the blood vessels in arteries of the heart in patients with ischemic heart disease. Number 2 cause of the inflammatory type is the leaky gut. Leaky gut when there are spaces between the cells that line the intestine from inside, the cells that are in contact with food we absorb. When there is leaks between or among these cells, some of the things that cannot penetrate to the lymphatic system or to the blood will be able to penetrate through these leaky areas or the spaces between the cells. Normally there should not be spaces between the cells. When there are spaces between the cells, many things can pass. When things that are not supposed to pass through these parts, through these leaks, it will go into the lymphatic system and it will stimulate the immune system because it's considered as foreign body. The body has to react against these parts that leak. So the leaky gut is a chronic illness. Every time the person eats, leak will happen. So you are continually exposed to antigenic material that cross from the inside the intestine to the lymphatic or to the bloodstream. So we need to identify the leaky gut and treat it. Number three, the microbiomes, the organisms, the bacteria that live in the intestine. This bacteria has a big role because if the bacteria are stimulating to the inflammation, the result is chronic inflammation. If the bacteria is healthy bacteria, it will act as an anti-inflammatory that reduces inflammation in the body. So we need also to know how to improve our microbiome. Also, candidal infections, which is fungal infection, chronic candidal infection, because candida has been found in brain of Alzheimer patients. Another, number four, is Lyme disease or tick-borne disease. There are diseases, some bacteria that are transported to the person by tick bite. It may attack the white blood cells, or may attack red blood cells, or may attack the blood vessels. It depends on the type of the organism. And these bacteria that's carried by ticks to the human has been found in the brain of Alzheimer patients. And this Lyme disease and the chronic fungal infections especially does not affect everybody. Even if he gets infected, some people will develop inflammation of the brain and some people will not get inflammation of the brain. It has been found that 20% or 25% of population are prone to get Alzheimer disease from the chronic fungus infection or tick-borne infections, while 75% of the population are not affected. Well, despite they are infected by these organisms, they are not going to get big inflammation in the brain. Why? Because there is something called innate immune response and adaptive immune response. To make it simple, I give example. If a bomb destruct one building and the fire occur, the first response is to bring the crew that's going to put out this fire. Then the second response, the cameras will be checked to see who did this bomb, who did this explosion. Then the police start to go and search for the person who did this crime. So the first response is to bring something to calm down this fire, to put out this fire, and give instructions to the people how to take care of themselves during this fire. The second response is the police will come and find the perpetrator. Same happen in some people, 25% of people. What happens is the innate immune response, which is the first response that happens, start to happen, and the second response will not happen. So the organism will keep living because there is no specific cells to kill this organism, and the organism keep alive in its place. And if it finds access to the brain, and this usually happens, it will create a state of prolonged inflammation, because the innate system, the innate immune response, this part will continue forever, because the second part, which is the adaptive immune response, will not happen. How to identify these people, 25% of the population who have this problem, we will talk in the investigation, or how to diagnose this inflammatory type. Now, how to test for the inflammatory type. First step, we need to know if the person has inflammation or not before going into comprehensive investigations. So there are markers of inflammation. One of the most important markers is homocysteine. Homocysteine level, we check it in the blood. It has two reasons to get elevated. Whether it is elevated due to chronic inflammation or vitamin B and folate deficiency. So if we find the homocysteine is high, It can be due to inflammation or due to vitamin B deficiency. We can give vitamin B and folate and recheck the level. If it comes down, there is no inflammation. If it did not come down, this means there is a state of chronic inflammation. The second and very important is the highly sensitive CRP. Many people know CRP. When a person get infection, we go and do test of CRP. CRP tell us if there is infection or not. If it is elevated, this means there is infection. However, the highly sensitive CRP is the one we need here, because chronic inflammation does not lead to elevation of the regularly done CRP, but it elevates the highly sensitive CRP. So if the highly sensitive CRP is 1 or more, this indicates that this person has a state of chronic inflammation. And the chronic inflammation can affect the brain and can affect the heart and the blood vessels of the heart. The third marker of inflammation is we test the albumin globulin ratio. This is a blood test. The albumin and the globulins are proteins present in the blood. The albumin has function is like swipe. It clears it helps to clear infection also. So we need it to be high, and the ratio should be at least 1.8. If it is less than 1.8, this means we have chronic inflammation also. And we can test for interleukin 6. If it is high, this indicates chronic inflammation. So at least we can do the highly sensitive CRP, which is not available in most of the laboratory. Most of the laboratories do only CRP. And the homocysteine, also it's not easily available. However, some labs can do it. And the albumin globulin ratio is easy to do, and the interleukin 6 also. Now, if the person has shown to have inflammation, what we need to do, if he has chronic sinusitis, we need to do culture for Marcon's. This organism that is present in sinuses. And we need to check the root canal and the periodontal disease, because these diseases, if not treated, can stay for years, creating disasters to the brain. And then we test for chronic fungal infection, like I mentioned before, and the tick-borne disease that I mentioned before. There are special tests for this we will mention later. Now, the treatment. The most important thing is to clear the infection, is to treat the infection. So we need to treat the root canal disease, and we need to treat the periodontitis with regular checkup of our teeth. And we give anti-inflammatory substances like the curcumin and the omega-3. And there is something called specialized pro-resolving mediators. It's called SPMs. It is approximately four names or four substances. It's called resolvins, protectins, and marizins. This is very scientific, but for the normal population, they need to know that there is something called SPMs. The role of SPMs, these are very good anti-inflammatory. They are derived from the omega-3. Like this omega-3 has submolecules, the one which has been discovered to have very potent anti-inflammatory effect. These 3 or probably 4 molecules. There is another one I did not mention here. We give this SPM to the people in the first month of treatment if the patient has chronic inflammation, to quickly calm down inflammation. Meanwhile, we are treating the cause of inflammation. So the priority comes first to treat inflammation, then we give the SPMs for approximately 1 month to calm down inflammation. Then we continue with omega-3s and curcumin. This is how we treat chronic inflammation. Reminding again, we need to clear the most important, to clear the source of infection. Now we go into the type 2, the atrophic type, which is the type happen when there is nutrient deficiency. Then the brain nutrient, the nutrients that feed the brain cells. These nutrients has been found to be the hormones, the vitamins, and some of the minerals. From the hormones, the thyroid hormones, especially the T3, because the T3 is the active hormone of the thyroid. The thyroid secretes 90% T4 and 10% T3. These 10% of the T3 are the active, the hormone that's active. This one is not active. It needs to convert to T3 in order to do its action. If it did not convert, T3 will not be found and there will be deficiency of the T3. In old people, usually they have problem of conversion from T4 to T3. So in the blood test, we see the T3 in the low normal range and probably subnormal, while T4 is still in the high normal range. Why in the high normal range? Because it's not converting to T3. So we need to optimize the T3. In traditional medicine or in the medicine we practice, we usually or almost always check the T4 and the TSH. I will come to TSH after a while. So if the T4 is normal and TSH is normal, we say to the patient, you are normal. However, in traditional medicine, we don't usually check on the T3. In Alzheimer disease, we must check on T3 because this is the active hormone that we needed to reach the brain. Why T3 is important? Because the T3 is the hormone of energy production. If you don't have T3 in your system, in your body, all your body cells will not function appropriately. Like you are driving the car on gear number 2. You cannot reach to the gear number 3 or 4. So you will find the patient lazy and not motivated and depressed and have body aches like that. Then the second one is the reverse T3. Reverse T3 is another hormone that comes from T4. So T4 become also something called reverse T3. The reverse T3, you remember here the T3 is the active hormone. The reverse T3 go to the receptor of the T3 and stand here, preventing the T3 from coming to the receptor and do its action. So we need to test for the reverse T3. In regular and traditional medicine, we don't test for the reverse T3. But in this protocol, we need to understand how much the reverse T3 the person have, because most of the patients are old, elderly, and in elderly, the conversion of T4 to T3 is impaired. However, it can convert easily to reverse T3. So normally, the T3 should be 20 times more than reverse T3. If it is less than 20 times, this means reverse T3 is high. And the patient is hypothyroid at the tissue level, while the blood test is normal. So we can see the T3 normal and the T4 normal. However, the T3 will be in the lower range and the T4 will be in the higher range, but both of them are normal. For the general medicine or for the traditional medicine, since both of them are in the normal range, there is no harm. But however, from the perspective of treating Alzheimer disease, we need the T3 to be in the high normal range also, or both of them in the mid range. However, if we tested the RT3 and we found it high, this means that T3 that's in the blood test is not working. The solution in this case is to give the patient combination of T3 and T4, or we give him only T3. In traditional medicine, they don't give the people T3 except if they are using too much T4 and the T4 is not bringing effect. And this only in hypothyroid patients. But our patients, most of them are not hypothyroid. Most of them are normal because the T3 and T4 are still in the normal range. But at the level of the brain, at the level of the tissue, the T3 cannot reach the receptor. So we need to give T3 in order to overcome the RT3 in order to go easily to the receptors. This is simple explanation about the importance of T3 and reverse T3 in the protocol of Alzheimer treatment. This is a big difference between this protocol and the traditional medicine approach to the patients, because in traditional medicine they don't usually measure the reverse T3 or the T3. Number two, the optimal progesterone. This is the female sex hormones, the estrogen and the progesterone. Progesterone has anti-inflammatory effect on the brain, and most of the patients, ladies who have Alzheimer disease, are already postmenopausal. And estrogen has been found that it is one of the factors that lead to shifting the APP that we mentioned in the previous presentation to cut into the two segments, which help to augment or make the neurons healthy and the connections healthy, and prevent it from cutting into the four segments that lead to appearance or cell death, because these four segments create death sentence to the cells of the brain. However, these two segments create happiness to the brain cells and make them vital and improve the connections and make new connections. So what estrogen do? Estrogen prevent cutting towards the four quarters, the bad four quarters, and enhance cutting towards the good quarters. And there is one study for ladies, patients who did oophorectomy and did not get hormonal replacement therapy. The incidence of Alzheimer disease in this group was double the normal incidence, which is objectively explains the role of estrogen in the prevention and even reversal of Alzheimer disease. And when we give estrogen to ladies, we usually give progesterone in order to prevent the anabolic effect of estrogen. So we need to give estrogen and progesterone to women with Alzheimer disease. This also is not in traditional medicine, because in traditional medicine they don't give hormones in the postmenopausal state. Why? Because of something called WHI study. WHI study, when they give the ladies hormone replacement, they develop cancer and thrombosis. But the problem with this study, they did not give the woman natural hormones. They give medications, and medications are different from hormone. They give medications with hormone-like action, like they give progesterone. They give progesterone, but I'm here. I'm talking about estrogen and the progesterone here. They give progesterone, but they give medication like progesterone. And when they give estrogen from horse urine, not human estrogen. So this study was very biased against, the result is very biased. This result does not express the natural human estrogen and progesterone. The estrogen and progesterone, the human estrogen and progesterone are different from the what we call progestins, which is the artificial hormones. So in this protocol, we use the human estrogen and progesterone. Now, this one is pregnenolone. The pregnenolone is another hormone. It has anti-inflammatory effect. Also, progesterone has anti-inflammatory effect on the brain. This is the second set of hormones. We need to optimize also to reach by testosterone and DHA. We need to optimize. Optimize means to reach by testosterone and DHEA to the optimum level for brain function. So testosterone range approximately from 10 to 30. Let's say example from 10 to 30. If you have 11 or 12 or 13, doctors say you are in the normal range, you don't need treatment. However, in this protocol, we need the hormones to be optimal. Optimal means in the higher third of the range. So to be in the range of 25. So and most of the male, old people male, many of them are hypogonadic. I mean hypogonadic, the level is even below 10. So you will find it 3 or 2 or whatever in below normal. This is an indication to give the patient testosterone. So the problem is if the patient is in the normal range but in the lower normal range. In traditional medicine, doctors don't give the patient testosterone. However, in this protocol, the patient must take testosterone because testosterone has receptors in the brain and has anabolic effect on the brain cells. Also the DHEA, which is called dehydroepiandrostenedione. This is for doctors. Now the vitamins. Vitamins is easy. Vitamins are easy because they are available and given by traditional medicine. The B1, B6, and B12, and also B5. B5 is very good for focus and concentration, and folate. The following one is a vitamin D. Vitamin D is very important because we give it with vitamin K2, like 100 microgram. So the importance of vitamin D, it turns out 900 genes, it activates 900 genes. So vitamin D act like a gene stimulator, and these genes are important for bone and for tumor suppression and help create and maintain the synapses in the brain. The synapses mean the brain connections, the cell connections. The cells of the brain connect to each other by something called synapses or the branches of the cells. It has anti-inflammatory effect. This is a vitamin D. So we benefit from the anti-inflammatory effect of vitamin D in Alzheimer disease. All patients should take vitamin D. Minimum 2000 international units per day from vitamin D3, not vitamin D2. Vitamin D3 is animal vitamin D. Vitamin D2 is plant source vitamin D. Also, selenium is very important for calming down inflammation, and glutathione is important as an antioxidant. It's the most important antioxidant in the body, and we can give NAC, N-acetylcysteine. It's available and can be given daily. It converts in the body to glutathione, in the liver to the glutathione, and the glutathione can help in removal of toxins in the body in addition to the selenium. Both of them act together to bring very good result as an antioxidants. Now, the message from this slide is we have traditional medicine rules in treatment. We cannot cross it. That's why if the patient will follow the protocol, we need to take a consent from the patient that there are some treatments in this protocol are not present in traditional medicine practice. This is very important, and the patient should agree about this. Now, we will go to the 1.5, type 1.5, which is insulin resistance. Why Dr. Pedersen give it number 1.5? Because it has characteristics from the inflammatory type 1 and has characteristics from the atrophic type 2. So it become 1.5. This is the trophic support, has characteristics from deficiency of the trophic support and characteristics of type 1 inflammation. So from where the inflammation come? Glucose, brain of Alzheimer disease cannot utilize glucose for energy production. That's why this help the cell die, because there is no source of energy to the cell. There is no food for the cell to live. The glucose, when it's present in the environment of brain cells, what it do? It binds to the proteins in the cell membrane. It binds to the protein. We call this glycation reaction. Like it react with the protein in the cell membrane and denature the receptors. The receptors are present at the cell membrane. The receptors contain protein. When glucose come here and combine with the protein in the cell membrane, it destroys the receptor. It denatures the receptor. And this molecule that appear after that, this called glycated protein, which is protein attached to the glucose, is not is the brain see it as a foreign body, and the immune system start to attack, cause inflammation in the cell membrane. So that's why excessive glucose in the brain is a source of inflammation. That's why this type carry the characteristics of inflammation. What about the loss of trophic support? Because insulin, because the insulin does not work in the brain. That's why the glucose cannot enter the cell. We understand that insulin lead to entrance of glucose into the cells for metabolism and make energy. If insulin is not functioning, and the insulin is anabolic hormone, insulin help in growth of the brain cells. If insulin loses its function, loses its trophic support function due to insulin resistance means the cells cannot see the insulin. The insulin does not produce its action. We call it insulin resistance in the brain. So we lost the trophic support of the insulin. That's why this type has characteristics of inflammation and characteristics of loss of the trophic support. As people know, or as doctors know, Alzheimer disease is considered diabetes of the brain, because in type 2 diabetes the problem is insulin resistance. The problem is the tissues of the body does not see insulin, cannot utilize glucose. That's why the blood glucose level increases and the patient become diabetic. The same happen in the brain of Alzheimer disease. The patient can be normal, not diabetic, however his brain has diabetes. This is Alzheimer disease, is diabetes of the brain. Insulin resistance in the brain and increase in glucose in the brain. This glucose will bind to protein and create glycated protein, which is immunogenic, stimulate immune system and cause inflammation. Now, how to identify insulin resistance? We need to measure the hemoglobin A1C. Optimally it should be 4.5. However, till 5.5, less than 5.5 is accepted. Fasting glucose should be less than 90. Fasting insulin, which nobody rarely checked. Fasting insulin should be less or equal to 4. Normally in the blood test you will see that insulin can be normal up to 10 microunit. However, in the protocol we need it to be less than 4, because we need to reduce insulin as much as we can in order trying to help the brain insulin resistance. And the last test and the most accurate is the HOMA score. HOMA score, in HOMA score we multiply the insulin by microunit multiplied by glucose in milligram per deciliter and divide by 405. This gives us a number, this number by which we can identify if the person has insulin resistance or no. Now we diagnosed the insulin resistance. What we need to do? The treatment. We need to go into intermittent fasting. The patient should fast 12 hours during the night, starting from 7 p.m. till 7 a.m. in the morning. So no eating after 7 p.m. So the last meal also, they call it keto flex 12 by 3. Keto flex 12 by 3, 12 indicates the number of hours that the person need to fast, and 3 is the number of hours that you need to stop eating before you sleep. So this period of fasting happen during sleep, and during this period there is no food in the system, in the body, and this help clear the defective organelles of the cell. The cell has many organelles inside the cell, different organelles in addition to the nucleus. These organelles, some of it become weak and not functioning properly. So this help in autophagy when we are fasting. This help the cell to kill its non-functioning or poorly functioning organelles and to create new healthy organelles. This is what we call autophagy. So by fasting 12 hours, we reach to a state of hunger or no energy in the system, which help in making ketosis, making ketone bodies. What is ketone bodies? Ketone bodies. If you don't have glucose in the system, your body start to utilize glucose as sugar. There is no sugar in your body. The body start to burn its own fat to make what we call ketone. Ketone is the product of fat, and glucose is the product of glycogen. So when glycogen is destroyed or become in the simple form, it become glucose. And when the fat becomes in the simple form, it will become ketone. The brain can eat the ketone. The brain can utilize ketone for energy production. Like it can utilize glucose for energy production, it can also utilize ketone for energy production. But our brain in Alzheimer disease does not utilize glucose, but it can utilize ketone. However, the energy produced by glucose, if we say it is 1, the energy produced from ketone is 4. So ketone is very good brain energy. Why we mention this? Because fasting help in making patient go into the ketotic state, mild ketosis. And there are instruments now available to check if you reach to this mild ketosis or no. Now, in patients who don't have the ApoE gene that I mentioned in the previous video, they need to fast for 12 hours. If the patient has the gene, he need to fast for 16 hours. So he need more prolonged fasting. Instead of taking his breakfast at 7, he need to take it by 11. So the longer the fasting, the better the effect on ketosis. We need also exercise, brisk walking or probably more vigorous walking for 150 minutes per week, at least 150 minutes per week. And now we will come to diet. When the person want to eat, what he eats? He need to eat mainly vegetarian diet, rich in fiber, because fiber help to grow healthy microbiomes in the intestine. Avoid sugar completely, no simple sugar, because we need to improve the insulin resistance and we need to reach to the mild ketosis state. If you have sugar, if you eat sugar, you will never become mildly ketotic. And we know ketosis means we make ketone the food of the brain. And no processed food, and we avoid dairy because it is inflammatory, and gluten because gluten sensitivity can cause leaky gut, and the leaky gut, as I mentioned before, can lead to leak of substances that excite the immune system and causes inflammation. And the protein, the meat, the red meat, is condiment, like minimum amount is to be given. So the main is the meal should be mainly vegetarian with meat or protein as a condiment. Now, we can give the patient oil, but not any oil, what we call MCT oil or medium chain triglycerides. Medium chain triglycerides, we have the triglyceride short chain, medium chain, and long chain. And the chain is fat, this fat, this fat, this fat. This fatty acid consists of carbon atoms. The short chain has lower number of carbon, intermediate has little more number of carbon, and long chain have more carbon chain. So it has been found that the medium chain triglycerides can get access easily to the brain without passing to the liver, and the brain can utilize the fat of the medium chain triglycerides to create energy. So now I am replacing the energy from glucose to ketone. and till the patient go into the ketotic state, we use this MCT oil for the first 1 month or 2 months till the patient adapt to the new dietary habits and start to create his own ketone by himself so that he does not need MCT oil anymore. After this period of 1 to 3 months on MCT oil, we convert to olive oil. This is the dietary recommendations for insulin resistance. I know the information is comprehensive and you can take notes or listen to the presentation many times to collect the information that you need. These are all information for you free in order to understand how to manage your patient. Some steps that like blood test or prescription need your physician, but this part of treatment of insulin resistance need the patient understanding to this step. Type 3 is the toxic type, and the toxins can be inorganic like heavy metals, especially the mercury, and inorganic like candle toxins like toluene, and the mycotoxins from the fungi like mold toxins. We'll talk about it now. And some toxins come from the bacteria that come from tick-borne. The tick, when it breaks the skin, it pushes its bacteria. As I mentioned before, these bacteria can reach the brain, and the mold toxins also can reach to the brain. And I mentioned there are 25% of the population can react aggressively to these two sort of infection, the fungal infection and the tick-borne infection, and activate the immune system for years without stopping of the inflammation. So these are the types of toxins that we need to check and search for. Now, this serves as a chronic inflammatory response syndrome. From the name, it is inflammatory response that's chronic, does not stop, and it's chronic due to chronic activation of the innate immune system, the primary response, without activation of the secondary immune response or the adaptive immune response due to mold toxins in Lyme disease. Now, how to identify this group of people? This group of people are genetically prone to chronic activation of the immune system. We do it by testing, genetic testing called HLA-DR-DQ and C48 and TFG and MSH, melanocyte stimulating hormone. So the genetic test can be done easily, and the C4A all this can be measured, and this is the normal value. It should be less than these values. If it is higher than these values and this one become positive, the test come positive, this means this patient is from the 25% of the population who can be affected by the mycotoxins and the tick-borne illnesses like Lyme disease. Now, regarding the mold toxins, mold is fungi. So these fungi live in the damp areas in the rainy countries, because the rain can wet the walls and can allow the fungi to grow on the wall. And we see in the wall, in old houses, even when the water go inside the wall, black mold grow on this wall. This mold that grow on walls due to raining and due to wet surfaces, even in the bathroom, even at the windows when the rains come, the mold grow. And one of the patient, when she lived in her house, she started to get brain fog and forgetfulness. When she go to visit her stepmother for a few weeks, during these few weeks she feel good and everything is fine. And when she come back here home, she start to have brain fog again, and the problem go on. So her husband decided to bring the company responsible for checking of mold. They found there is mold everywhere in the house. And the point here, whether to treat the house or to change the house completely and live in another house. Regarding the mercury toxins, the mercury is present in the amalgam fillers of the teeth. This is old filler, and many people now living with this old filler. This has been found that this mercury filler evaporates, and its vapor contain mercury that can cross to the brain, cause brain toxicity. Also mercury is present in big fish. We will see later this point. We need to do for toxins here, and especially the mercury and the heavy metals. Here, urine and the blood test for heavy metals, and urine test for trichothecenes. This is one of the dangerous fungi. Ochratoxins, aflatoxins, and gliotoxins. This urine test can be done for these fungi and tell us if you have fungal infection or if the patient have fungal infection or no. Now, the treatment is remove amalgam from the teeth. There are specific special doctors specialized in removing amalgam. If you have more than one tooth with amalgam, you don't remove all amalgams in the same setting, but give a space more than 1 month between removing one amalgam to the other amalgam, and it has special precautions during removal, and the doctor should be aware about this step during its biological dentist who can remove the amalgam. We need to avoid the long-lived fish which live for many years and become very big in size, like tuna and swordfish and sharks. And one story of the patient's a very big businessman, he decided to eat healthy. That's why every day he eats tuna. Then after approximately a few months, he started to have brain fog, forgetfulness that impacts his ability to do his work. Then he go for checking, and they did for him a test for toxicity. They found in him the highest mercury level ever measured in a person. And after they did the detoxification program to him, he became normal again. And by the way, his brain showed criteria of Alzheimer disease due to toxin only. When we need to eat fish, we need to eat smash fish, the small fish or the short-lived fish, like salmon and the mackerel and the anchovies, sardines and the herring. Because this fish does not stay in the sea for long time to collect mercury from the sea. However, the big fish, because it lives long, it collects in its protein, in its flesh, high mercury level. Then treatment of the toxin, we need to go into detoxification program. There are many detoxification programs, but some of them oral, some of them intravenous. This is a special topic by itself, and it needs another presentation. And most important for mold infection is to remove the person from the house. I forgot to mention that in this type, the this atrophic type. Now there is one food called Souvenade. Souvenade. This Souvenade is a diet in a bottle. It has phospholipids, it has vitamin B's, it has omega-3s, it has magnesium and selenium. So it has most of the nutrients that are needed for Alzheimer patient, and it has been studied, and the result on patients who use this food. It's food in bottle, one bottle every day. I think it's 150 ml every day. The patient take it between meals. It will help to improve the cognitive functions. This will help because they put many things in one bottle, and it's very effective in improving brain function. In addition to augmenting the hormones and other things. Now we reach to the toxin and how we treat the toxin. Number 4, the vascular type. Vascular type is what we mean by vascular type. Some patients get recurrent strokes in the brain, and these recurrent strokes impact the cognitive function. especially if the patient has atrial fibrillation. What we call it, they have thrombus in the left atrium of the heart, and the left atrium here does not contract like normally. However, like shivering, it will not contract, and the blood clot forms in the atrium. And if he does not take anticoagulant, this blood clot will fragment and go into the systemic circulation and reach the brain. And it can affect the brain not only one time but many times, and the end result is the patient start to get dementia. Patient who have uncontrolled hypertension, smoking are risk factors. And if the patient has high cholesterol level, he need to take statins also. Now we come to the area of investigation again, how to put all investigation together. Dr. Bredesen suggested that all patients, all people start to test themselves by the age of 45, and before that, especially if you have family history, one of your parents or grandparents get Alzheimer disease, you need to start earlier to test yourself if you are prone to have Alzheimer disease in the future. You need to know your ApoE status. You need to know if you are ApoE4 or ApoE2 or ApoE3. And we mentioned before the risk is ApoE4. Before, the person who discovered the connection between ApoE status and the Alzheimer disease, she was a scientist. She refused to do the test for herself. She said, what benefit I know, what benefit I get if I did the test and it showed that I am very prone and I am prone to Alzheimer disease. There is no treatment. So why I know and I become worried that one day I will get Alzheimer disease. This was before this protocol appears. However, this protocol advises everybody to know his ApoE status early on. So because there are now, this protocol is preventive for Alzheimer disease. If you follow this protocol, you can prevent and protect yourself from getting Alzheimer disease. That's why now it become important to know your ApoE status. You need to do the homocysteine and the CRP, highly sensitive CRP, and albumin globulin ratio. I mentioned this before, and the interleukin 6. And you need to check for B. gingivalis and herpes simplex and Borrelia, Lyme disease. These are the tick-borne diseases and various fungi. You need to test yourself. You need to check your gums, sinuses, and you need to check for insulin resistance. Your hormonal status should be optimal, and your nutrients should be optimum. You need vitamin D. You need to study, if you have mercury level and other mycotoxins in your blood. Mycotoxins is the fungal toxins. And you test for chronic innate immune response syndrome, especially if you live in wet areas, and wet areas in America, in Europe, and North Africa, and some places in Asia. You need to test for microbiome in the mouth. Microbiome are not only in the intestine, it's also in mouth and nose and sinuses and gut. And there are now supplements to improve the microbiomes in all these areas. However, the most important is gut. You need to know your body mass index, your weight, because if you're overweight, you need to reduce your weight. Now we come to the last one, which is volumetric MRI. We usually use the volumetric MRI in patients, and in Arab countries we don't have the software for volumetric MRI available everywhere. However, it's easy to apply to the MRI. The importance of this, it measures the size of the hippocampus. Hippocampus is part of the brain in the temporal lobe here. This hippocampus is the area of memory. The size of the hippocampus reduces if you get Alzheimer disease, till it completely finish. So you find the temporal lobe of Alzheimer patient is very small, and the hippocampus is like a rim. So it measures the size of the hippocampus, and by monitoring the size of the hippocampus, if the patient apply the protocol, they found that the hippocampus start to grow again, and this what we call brain plasticity, something which has been discovered by Dr. Bredesen also and other colleagues. that the brain can again gain a size, because it was known in medicine that the only cells that if die not come back is the brain cells and heart cells. However, now this protocol can bring again and build again new connections and bring new cells. Also, the volumetric MRI give us an impression about the type of of Alzheimer. If there is generalized atrophy, like all the brain gets smaller, including the hippocampus, this is probably atrophic type. However, if the hippocampus is mainly atrophied like this one, and the brain size is approximately normal compared to the hippocampus, which has been atrophied, this gives indication to type 1 and type 2, which is if there is generalized atrophy, this type 3. If there is only atrophy of the hippocampus, it denotes type 1 and type 2, the atrophic and the inflammatory type. The volumetric MRI, we use it, it should be used in patients to monitor their improvement on the protocol. Now we come to additional measures that we give to the people, or we need to test. We need to test for obstructive sleep apnea. What is the meaning of obstructive sleep apnea? Normally, when we sleep, we should breathe normally. Our breathing should not stop during sleep. However, in some people, their breathing can stop 10 times, 20 times, up to 100 times during sleep. This creates interruption of the sleep, like you are supposed to sleep 7 to 8 hours continuously without interruption. Why this is important? Because during sleep, the brain cleans itself from the harmful proteins that has been accumulated during the day. Also, growth hormone released during sleep, and the growth hormone help making new connections and new cells. If you don't sleep optimally, your brain will not be cleared enough, and you wake up next day like you work with all the batteries. However, if you sleep 8 hours uninterrupted, minimum less than 10 times per night, it can be considered normal. But if you cannot sleep without interruption, that can reach sometimes to 100 times, this means you don't reach deep sleep. So you will get exposed to, you cannot clear your brain from the toxins, and you will not get the beneficial effect of sleeping on the brain. Exercise, we need to do aerobic, both aerobic and resistance exercise, because both of them help to reduce insulin resistance, reduce stress level, and improve vascular function, the blood to the brain, and increase ketosis. So when you're fasting for ketosis, if you do exercise during the fasting time, it will help to consume the glucose quickly and go into fat and start mobilizing fat and form ketosis. It also improves the mood. That's why exercise is very important in the protocol. Treat depression, because depression, most of the patients who develop Alzheimer's disease pass by a stage of depression before going into Alzheimer's disease. So treating depression will help to prevent the occurrence of Alzheimer's disease, because depression is associated with increased cortisol, and increased cortisol level lead to hippocampal atrophy. The hippocampus is the area of memory and the cognition in the brain. And we talked already about sleep. Social connections and relation is also one of the factors that can help to ameliorate cognitive decline. Stress reduction, some specific herbs that help make new connections, like lion mane and PQQ. PQQ is the only substance that has been found to increase the number of mitochondria, which is the mitochondria is the powerhouse of the cell. And mental exercises, to train the person to do mental exercises to keep the brain cells active. Now, the supplements. All patients with Alzheimer's disease should receive these supplements. There is Veratrol. Resveratrol stimulates the 31. I mentioned it in the first presentation or the previous video. 31. This 31 is a gene that act as anti-inflammatory and also a longevity gene. Like if you have this gene active, this help you live longer and healthy. So resveratrol 100 milligram help the stimulation of this gene. Nicotinamide riboside for energy production 100 milligram for all. Acetylcholine is important also. It support the synapse growth, the connection between cells, and maintain these synapses. Alcar, which is acetyl L-carnitine, it increase nerve growth factor. Nerve growth factor is a stimulation for nerve growth, especially in the atrophic type, a type which has nutrient deficiency. Ubiquinol support mitochondrial function. All these supplements are available in the shops that sell supplements. Pantothenic acid, vitamin B5, it's important for alertness for people who are sleepy and with less focus. Pyrroloquinone, which is the PQ I mentioned before, 10 to 20 milligram increase mitochondrial number. Whole coffee extract 100 milligram OD increase the brain-derived neurotropic factor. This factor is important from its name. It's neurotropic, like it improves its nutrient to the brain cells. These are the important supplements that everybody with Alzheimer's disease should be on. Now the take-home messages from this video. Treatment of Alzheimer's disease is not one size fits all. We cannot treat all patients similarly because, as we saw in the presentation, there are different types of Alzheimer's disease. Each one is different. One has different causes. That's why it needs a personalized program. Each patient is different from the treatment of each patient is different from the others. You need to check the ApoE status, as I mentioned before, and the patient should appear early because this program is very effective if you appear before you has been diagnosed by objective test as having cognitive impairment. Despite if the person has been diagnosed as having cognitive impairment, this protocol improves, but the improvement will not like if the patient come in earlier stages. I mentioned this point clearly in the previous video. The rules of this protocol, some of its rules are not supported by the conventional medicine, so it needs a consent to be taken from the patient. The children of the patient should come early and do the cognoscopy. Cognoscopy, the word cognoscopy is similar. It is like colonoscopy, but the Dr. Bresson called it cognoscopy, like cognitive function scope. So the children of this patient should come early at the age of 40. However, if you don't have any parents have a problem and you need to check yourself, you can check by the age of 45. The people should be informed about the importance of cognoscopy that we mentioned now. The people no, because the media don't talk about this, about that Alzheimer's disease has a protocol, and about this protocol is effective in not stopping deterioration of Alzheimer's disease. No, it is important, and its function is reversing Alzheimer's disease, like making people with cognitive impairment become normal again. And the earlier you start this protocol, the good the result, the better the result. So don't wait till you reach till your patient or your baba or your mama reach to advanced stage of dementia and you start to think about giving them the protocol. Always the earlier the better. So a move from our side in Arab countries and in the Middle East is needed to convince the authority to implement this protocol for patients with Alzheimer's disease. Because there is no other hope. Alzheimer is a death sentence, despite it is not an immediate death. However, it is a death sentence that is preceded by many years of suffering that affect the patient and the family and the community. And since there is no other treatment and this protocol has shown its effectiveness in reversing many cases in the States and in 150 countries all over the world. I suggest to the authorities, the health authorities in the Middle East countries to start study this protocol and implement it on their patients. Thank you. And if you see this presentation helpful to you, please share it to other people and take notes. And you can educate other people also about this protocol. And thank you so much. Like the video and share it. Thank you.